Hello everyone, my name is Rachel Cuneo. Thank you all for coming. It is July 2nd and we are currently in Hunter Library. So today I will be speaking for my informative speech for my COMM 201 class. And today my speech title is Fears Living in You. So before I continue, I have a question. Who all in this room is scared of something? Yes. Oh, heights. Okay. Who else?
Scared of dying.
Okay. Good answers. My example is I'm terrified of spiders. Ever since I was young, they just make me skittish. I don't like the idea of their legs crawling on me. It's just been one of those fears I've always had. So the reason why I ask is because I'll be speaking on phobias. So before I continue the lesson, let's go over the difference between a phobia and a fear. So a fear is an emotional response to a threat. A phobia is very similar. It's just their anxiety levels are so strong, it affects their ability to react to things, to function in basically life. So a phobia is an irrational fear that someone experiences, an individual experiences with deep sense of panic. You can have a fear of an object, a certain place, a situation. Today we'll be talking about 5 specific phobias: environmental, situational, blood injection injury, animal, and other. So signs and symptoms. So when you see someone with a phobia, there's a whole bunch out there, but these are quite a few. You might see them feeling nauseated, maybe wanting to faint, maybe dry mouth, shortness of breath. Maybe their blood pressure is increasing. Sometimes when you can tell when they're speaking, sometimes they can't get the words out, or maybe they're talking way too fast. You can hear them shaking in their voice or trembling. So what type of phobia are you? We're going to start with animal, which is the most common one. It is the fear of animals and insects. So spiders, snakes, sharks, bears, etc. And so this usually happens in the range of early childhood. And the prevalence rate is 4.3 to 12.1 in women and 2.7 to 3.3 in male. And before I continue, a prevalence rate basically is referring to the number of cases of a disease in a population at that given time. So basically the population percentage. And so a treatment for this phobia is cognitive behavioral therapy, also known as CBT, which we'll get more into that when we talk about treatments. Environmental is the next one, which is the fear of storms, heights, water, the dark. Their prevalence rate is 8.9 to 11.6% and ranges from child to early adolescence. Now, environmental and situational phobias kind of cluster together because they have very similar traits. And their treatment also can be CBT. So blood injection injury. So this is the fear of sight of blood, being into a medical procedure, having the thought, or even having an injury, maybe transfusions or injections. This happens usually in the early childhood. Their prevalence rate is 3.2 to 4.5%, and they also can be treated with CBT. Now, situational, like I said, environmental and situational is more clustered together because of the similarities. This is the fear of me driving or even riding in a car, flying an airplane, going through tunnels, going over bridges. They range from teenage to early adolescence or to early adulthood, and their treatment is also CBT. The last one is other. Basically, everything random that couldn't fit in the first 4 options. So this can be things like fear of color purple, fear of sunlight, fear of choking or vomiting, stuff like that. Their prevalence rate is 8.7 to 18.1%. Usually ranges from childhood or adolescence, and their treatment can also be CBT. Now, who are all at risk? So individuals, most likely with a family member who has an anxiety disorder, can sometimes get a phobia. Maybe if you had a traumatic event or situation, can lead up to having a phobia about that situation. There is a ratio of 2 to 1 for women to men who have specific phobias. Some statistical things I found, which was 75 to 90% of females have animal, environmental, or situational phobias, and 55 to 70% of females have blood injection injury phobias. So I listed kind of a few phobias that I thought were kind of interesting, I've never really heard about. some kind of common I just wanted to share. So the first one was iatrophobia, which is the fear of doctors. So this is the other phobia category, and this is early childhood, like pediatrics. So these individuals their fear is maybe experience pain, maybe the mistrust of their physician's skills or their authority, maybe hearing some bad news. Most of the time, these individuals can attend these doctor's appointments, but most likely before or and after their appointments, their anxiety levels increase. And this is something that also can be treated with CBT. Now, cynophobia is the fear of dogs. So this obviously is phobia type is animal, most common in childhood. And this is, like I said, with the doctors, they will avoid these times. So if they see a dog in person, they're not going to want to go near it. If they know a friend or family has a dog at home, they're going to avoid going to their house. Maybe if they hear the word dog or even hear a bark, whether it be on TV, whether it be in reality, they can go into a full-blown panic attack. And that is why it's a difference between a phobia and just like a fear. And it also can be treated with CBT. So aquaphobia is the fear of water. This is environmental and most common in children. Their core focus is danger of harm, such as drowning, which most people have. These individuals will avoid bodies of water, pools, fountains, fishing, boating trips, things like that. And sometimes these individuals will never learn how to swim because of how high their anxiety levels are. And this as well can be treated with CBT. The last one, most common, fear of speaking in front of an audience, which is glossophobia. This is a situational phobia, and like I said before, these individuals will go out of their way to avoid these situations, to stop drawing attention. This can be really hard for students, especially at school, workers at work, because this is what you do on a daily basis. Even anything when you have social interaction, this is something hard to avoid. It also can occur with a fight or flight response. Fight meaning how they confront that threat, and flight, how they escape from it. So the last few things I'm going to share are just some treatments I found. Psychodynamic therapy was the first one. It is not very much an effective one. Most people don't choose this, but it allows the individual to be aware of what the phobia is due to that traumatic event. And it has two main points, the structure and the theory of the treatment. So the structure is the sessions per week, how frequently you're going, and then the theory is, okay, what is the process of this? What is our goal, and how are we going to control that anxiety level? Cognitive behavioral therapy, also known as CBT, which we've talked about, is the most common and most effective. So basically, you have a list, you ask the individual to make a list from least distress to most distress. So say an individual has arachnophobia, fear of spiders. You may ask them to touch a piece of paper that has a cartoon spider on it. Now you and me would be like, I can touch it, it's fine. Like, it ain't gonna do nothing to me. Well, an individual with arachnophobia might have a panic attack. See, that's what the difference between a phobia is, between you and me, and those with phobias. And for maybe something that's most distress, you might ask them to put a little speck, even a small spider, let it crawl up their arm. Doing these frequent sessions can help them control that back. And pharmacological is the treatment that's not so effective, but some may use it. It is mostly required to get a psychiatric assessment before the treatment plan, but is not considered a treatment of choice for a specific phobia. It can be used for like antidepressants, helping to reduce the symptoms of their anxiety levels. Any questions?